In today's topic, we are going to cover the technique of liquid rhinoplasty or non-surgical rhinoplasty. In an earlier video, we have covered what are the indications, in whom you can do it, and what kind of an outcome you can get from a liquid rhinoplasty. In this video, I'm going to show you it's a simple procedure that can be done as an outpatient. It doesn't need too much of preparation. It's done under local anesthetic or topical anesthesia if you're not comfortable in giving a little local anesthetic. You can either do it with needles directly or cannula, and I prefer to use a cannula because I find getting into the right plane easier, and I also feel that the bruising is also fairly less. I usually give a little bit of local anesthetic at the entry point, so it's absolutely numb. And once it's numb from there, you can manipulate your cannula in and get into the right plane. Once you do that, you will find that it's a very comfortable procedure. The plane, you can pass it right up to the dorsum in the plane between the SMAS and the periosteum. And then you can lay your filler there in a withdrawing fashion. So never inject in for antegrade, but when you're withdrawing the needle or the cannula. From there, once you have done that, you can then go onto the side of the nose. If you want to do the tip, you can do a little bit of triangular placement of the tip. Sometimes you may need to use a needle when you're doing the tip, but if you want to support the rim, you want to add a little bit of stiffness or volume to the rim, you can pass the cannula between the outer skin and the inner lining in that plane, and you can place the filler there. So a lot of this work can be done with the cannula, and I find it's easier. You can of course do it with the needle as well, and that's a personal preference that some of the surgeons may have. And you can see in the video that we have shown that it's a fairly comfortable procedure, hardly takes any 15-20 minutes to do. You can also layer the filler down in the columella. You can place filler right at the bottom here to lift up the tip or rotate it backwards. So a lot of things that can be done which can help in reshaping the nose, and this video is showing the technique. Once this is done, you apply a little bit of topical antibacterial ointment, and that's it. And that entry point, it closes in 24 hours and it becomes invisible. It's not seen. So this is the way liquid rhinoplasty is done in our center. And if you have any interest in considering this for yourself, I would suggest you contact us, come for a consultation, see if it's a suitable procedure for you, and see how it goes. So if you've liked this video, please subscribe or don't hesitate to share. Thank you very much.